loosey goose. Let's go. Good.
And I feel like if Kit Kat and Twizzler had a baby, Twiz Cat.
Gentle, let the head relax here.
Yeah, that's nice.
How about we start with some easy stuff? Back pain, neck pain.
Neck pain for sure. Back pain, maybe lower back, more towards my left side, like hips, I guess.
How often do you experience that?
Daily.
Morning or night?
I think I probably experience it more towards the nighttime, and then when I'm first waking up in the morning, I've not like really been sleeping the way I used to. I'm a side sleeper, so ever since I had surgery recently, it's kind of just uncomfortable. I don't quite lay the same way I used to.
Okay.
I definitely think it's post-surgical because I wasn't having quite as many problems prior.
Do you ever get any pain that goes down your legs?
On my left side.
Does it go down past your knee?
Not usually, no. Most of the time I get really bad muscle spasms, like cramps, things
How
like
often
that.
do you get that?
That's almost daily, but usually at nighttime is when I experience that.
Did your back or hip ever bother you while you were working out?
It usually does, and it goes back to my knee because I've had the 4 left knee surgeries, so usually I'll start to get some muscular weakness, and I instinctually just shy away from that because I'm so used to feeling that knee slip and then knowing what has to come after that.
4 surgeries, tell me about it.
Volleyball. I love college athletics. It was great to me. So, yeah, this is kind of the aftermath of that. I was a multi-sport athlete and then had to stick to one. Volleyball definitely took it out of me, though. So I think my last surgery was going into sophomore year of college.
So you had surgeries in high school on your knee.
Several.
What were they doing?
They took out pretty much all of my chondromalacia. I kept ruining that. It was like a giant snow globe when you saw the MRI. My medial and lateral meniscus is pretty small now. They kept taking out sections of that, tore my MCL, tore my ACL, had those repaired. And then I've had several just like injections, fluid taken off, cortisone after cortisone shot. It's very painful couple of years.
Do you brace your knee when you work out?
Not anymore. I used to in college, but not anymore. Neck and shoulders, usually it's just when I'm like waking up in the morning, going to sleep at night and waking up, I'll usually feel like little kinks or something, and they'll go in through here. And
all right. Do you take any pharmaceutical medications right now?
No, not at this time.
All right. Do you have any health diagnoses that you've been given that you've had to take medication for either at any time in your life?
Yes. So I've had my PCOS diagnosis, and so in order to do fertility treatments and whatnot with IVF, I've had to go on to Clomid, metformin, a couple other things. I mean, there's a list, honestly, I could pull out. I've been off of pretty much every pharmaceutical now since about October.
You've had lots of blood work, and
Yeah, I
have
used
you
to
ever
get
had
weekly.
Weekly?
Yeah.
When you were on those meds?
When I was on those meds, prior to it, it was a very long process.
How long have you been trying to get pregnant?
Since September of 2021. I remember exactly when we made that decision, and took about 8 to 9 months of me being extremely frustrated to seeking out fertility specialists and realizing, okay, you really need to be trying for over a year before anybody will even look at your charts. And then they'll slowly introduce you into different things, like maybe we can give you things like metformin or Clomid to help get your body on the right track and want to help you ovulate. But this was all prior to my PCOS diagnosis. So another year of that turned into, okay, well, I think she might have PCOS. That in conjunction with cystic fibroids I had on my cervix and on my ovaries as well that I had removed. I've had that removed a couple of times in my life now. Painful, very painful. Yeah, but doing all of that, it took a very big toll mentally and physically, so kind of took a break from medications, pharmaceuticals, and then dealt with all of my breast issues. So definitely had to be off of all of that while I was going through that process.
All right, tell me about your health history in the past. Have you had any serious conditions?
Yes. So in October of last year, I was diagnosed with breast cancer. It was definitely very scary. My mother had it, my grandmother had it. Found out through all of the genetic testing that it actually didn't come from either one of them, but from my father's side. So that was pretty shocking, but also comforting to know what I would potentially pass on if I ever am able to conceive. So that was definitely a time. Decided to have a triple lumpectomy and then an immediate reconstruction. So that surgery was done in April,
You mean
mid-April.
they did it the same day?
Yes, all on the same day.
Can you talk about how that opened you up and to start reevaluating things in your health?
I think it really just made me take a look at how I treat my body and what my body might actually be capable of doing on its own. I think we're so programmed to go to the doctor, take whatever it is that you're told to take, which I'm not saying that's wrong. It might be the right thing in that circumstance. But when you feel like you're doing everything right in your life, you're working out, you're on a good diet, your regimen seems to be perfect for you, and then one day you find a lump and you go to the doctor and it's not a lump that should be there, it kind of just sets you back mentally and you think, wow, okay, what am I really putting in my body? This is supposed to be healthy, but is it? What is it actually doing for me? So things that I realized I was doing that I thought was healthy wasn't really healthy. It was being sold under the label of, oh yes, this is great for you. This is going to cure X, Y, and Z. But where I was getting it from was, just processed plants with tons of sugar. And if anyone knows anything about cancer, what do cancer cells feed off of? Sugar. So those things kind of made me realize this can happen to anybody at any point in time. It's not just genetic, it can be extremely environmental. And if you have the ability to control how you're treating your body and what you're doing with it, then why not look into it?
All right, looking at the feet first, heel strike, mid stance, and toe off. They look symmetrical bilaterally. I don't see any differences. I don't see anything crazy going on with the ankle. There's a slight pronation on the right side, which is the opposite of the problem side that we have here. And we'll look at the Achilles tendon a little bit closer up, but I definitely see more angulation on the right Achilles tendon, indicating a pronation there. Could be a drop pelvis, IN ilium, correlating. Okay, from the knee down, I don't see any genu varum, no genu valgum. That looks straight up and down. From the knee to the hip, it looks straight up and down. The distance between the arms and the body looks symmetrical and even. Maybe a little bit more favored in the left shoulder swinging, and a little bit more stagnancy on the right side. The tip of the scapula is here, so we have a higher left shoulder. And if we were looking at the height of the ears, we have a corresponding high left ear mastoid process. And the left side occiput has gone anterior there. We'll see if that translates to the front, and if you have those asymmetries in your rib cage, and that could be affecting how your rib cage affects your hip. And the abdominal cavity contents are all suspended by ligaments that are attached to the bony system. So if any of these ligaments are in tension, that can prevent the way that the glands function. And usually they over-secrete. So PCOS is you have all these cysts. Yeah. It's from the hyperproduction of glandular activity.
It's crazy how everything's so connected.
This is the level of L3. I'm going to push into this segment just a little bit more, okay? Does this feel different to you, left and right?
I think it feels like maybe the left side is more, what do I want to say?
Tight.
Yeah.
This tender right there.
Yeah, but like in a good way.
Doesn't feel like that over here, right?
No, it doesn't.
Your mid-back is working harder. This is a little bit warmer here. This cools down here. A little bit warmer right here. The muscles are working a little bit harder. 2, 3, 4, 5. Okay, upper SI joint, right or left? Is one more tender than the other?
I don't know if one's more tender.
Okay, that's good. Same?
Yeah, they're
Okay.
about the same in tender, I guess.
Okay, lower SI joint. Right, left, or same?
Oh, actually the right might be worse than the left. Yeah.
Right there, right?
Yeah.
S4 on the right. Okay, checking the muscles here first, the rhomboid muscles. They are symmetrical, but the inferior portion of the rhomboid major is tight right here. This is where all that warmth is coming from. Okay, rotator cuff, supraspinatus, or excuse me, infraspinatus, and teres, subscapularis. Just a little bit more stringy here on the right side.
Yeah.
The tender.
Tender, but again in a good way.
Two, three, four, five, six, seven. Is that tender right there?
Yeah, it's like, it feels just tight.
Okay, which is the most tender? Ready? 1, 2, 3, 4, 5, 6, 7.
Between 3 and 4, I would say. Yeah, like right in like there, yeah.
Okay, so that indicates T6 and L2. Okay, bring your chin down to your chest. Good movement there, back up. Good, we'll go ear to shoulder this way. That was your atlas up
Good,
here.
so I was curious.
High left shoulder, and then it cracked when we went this way. High left ear, high left shoulder. So often when something cracks that easy just by going like this, it means that there's something either above it or below it that's restricted. And so you have one segment that's compensating and it's got all this extra motion, so it just cracks super easy. But really there's often something stuck deeper in there. Tender here.
Yeah.
Good. This relates to L5 down here and the L2 reflex. L2 reflex is part of the digestive system. It's right above the glandular system as well. So we're going to work those reflexes.
Fascinating.
So I want you to make a pointer finger with this finger. We're going to put this right on top of the PSIS, which is right here. So leave that right there. Now put your right arm out to the side. Okay, push up against me right here, against my arm. Okay, pushing. Good. 1. Now bring this up here. Pushing again. Good. And now I want you to bring this behind your ear. This right here. Good. Push up again. Okay, that's good. Go ahead and push up. Ready? Strong. Strong. You feel that? Good. Now go back down to this one here.
Okay.
This is category 2. Push up against me. Good. Strong. I'm pushing. Can't break it. Good. You ready? Now put your finger right there. Push up against me. Not bad. Is it harder there?
A little bit, yeah.
Yeah, let that relax. Yeah, see how your head went forward and
It
try to come? Let's
did.
keep your head like that.
Okay.
Put your arm back out again. Push up again against my hand.
Yeah.
Do you feel that?
Yeah.
Which is cracked? Is that your
I
shoulder
think
right
it was
here?
right here, yeah. That's what it felt like.
Okay, category 1. Okay, nice, gentle breathing. Okay, I just want to, let's see how this feels when I push into your back, how it feels in the front, okay?
Okay.
Okay, if I push like this, is this too much pressure?
No.
Okay.
You're good.
All right, I think we should be able to adjust this. If we have to modify it and adjust the other way, that's fine. These guys are right here. Tender?
Yeah.
Okay, let's test this again. 1, 2, 3, 4, 5, 6, 7. Definitely 4, right?
Yep, that was exactly what I was thinking.
All right, so 4 indicates T6, L2. So let's find 1, 2, 3, 4, 5. Okay, ready? I'm going to push down here. When I push here, is this still tender or does that go away?
It's not as tender as it was.
Okay, now let's see what's happening to this L2.
Oh yeah.
Still left?
I feel like they're both, but definitely on the left a little bit. Yeah. They're both very,
Okay, ready? 1, 2, 3, 4.
oh yeah, that's crazy.
Feel it, right?
Yeah.
Feel this release up top when I
Yeah.
push here. Pain modulation, it's all reflex control, central nervous system.
It's just so wild to me.
You have some lymph nodes here.
Yeah, I can feel that.
Tender.
yes.
Okay, this is the transverse process of C4, the fourth cervical vertebra, which matches with this L2 over here. It should dissipate quickly. All of these reflexes are the alarm system of the body. It's like when something's been out for a while, these are the points that we use to determine what's been out.
Yeah, because I can feel that like radiate into my jaw and kind of like up behind my like ear, like in the back of the head.
Okay. Okay, thanks for that information. That means we need to adjust your cervical spine soon. Okay, we'll come back to this. All right, this is topical magnesium. We're going to do this to help bring a sedative effect to the muscles.
Okay.
Nice, gentle breathing. skull and the fascia from the scalp. They all meet right here. Lots of nerves, lots of tendons. So we're just going to work these out. Try to help this right here. This thing is stubborn.
Oh, yeah.
Okay, nice, gentle breathing. Tender?
Yeah.
Okay, deep breathing. Breathe through it, okay? I'm going to squeeze hard for about 8 seconds, then we're going to let go. Good. Deep breath in. Good on the out breath. Breathe out vigorously. Deep breath in. And out. You crack a couple of things?
Yes, let's do it.
Okay, we're going to start with this guy right here in the middle. Nice and gentle. This is T6. That's good. Try to let your shoulders down just a little bit more. Good. That was a good relax there. You can tell it popped. Let's move your arms. I'm just going to take a little bit of magnesium off the top. Accidentally kicked the singing bowl. That's okay. Nice, gentle breathing in. Good. We'll follow the next breath out.
Ooh. That was very nice.
This first. Nice, gentle breathing. Same thing. And out. Good. Shoulders relaxing. Gentle, gentle.
Oh, wow.
It's deep. Just that one solid clock. Go ahead and take a deep breath in, and then let your shoulders relax as you breathe out. Let it all go. Okay, left short leg. With it turned inward like this. You feel that?
Yeah.
Okay. EX on the left. For sure. An EX. I haven't seen an EX in a while. Okay, I'm going to bend your knees, okay?
Okay.
All right. Just try to let it relax. Let me do the work. There you go. Could you feel any pain in your back when I do this?
I can kind of feel it tight, like the left side a little bit.
Over the hip?
Yeah.
All right, I'm going to see if there's any restriction in your tailbone, okay?
Okay.
All right, so this is the sacrum right here. This is the top of the sacrum. Here's the S1. S2. Fourth segment. Is that still tender? This is what was tender when you were seated.
Yeah, it's still tender.
This is the fourth sacral segment. And then if we come to the middle here, this is the first coccyx segment. Is that tender there?
No, it's actually not bad.
Okay, testing to the left of the coccyx. Is this tender here?
Yes.
Is this tender here to the right?
Yes, but not
Not
as
as
bad
much.
as on the left. But when it was a little bit up higher on the right side, that was more painful or tender.
That was the most
Yeah,
painful,
that one, yeah.
Okay, so this is your SI joint. This needs to be adjusted, okay?
Gotcha.
This is not a joint. This is the sacrotuberous ligament. So this is how we treat this ligament. I'm just going to pull it to the side like this.
Okay.
And then we're going to contact that occipital fiber up here again at the same time. Nice gentle breathing. This takes about a minute. Nope, it already let go halfway at least. Good. You're breathing. It's loosening. All right, testing again here. We're gonna go like this. All right, do you still feel that in your left hip?
Nope. It feels pretty good.
See if there's any trigger points in the top of the glute max and medius here. This thing right here, right?
Yeah.
All right, well, we're gonna come back and work on this a little bit, but let's just hit a trigger point here one time, and then we can retreat it later if necessary. Okay, you're gonna take a deep breath in. Out. In. Out. One more time in. Out. Okay, breathe.
Holy crap.
Okay, left. Down. Right. Down. Left. Down. Which side is more difficult?
I almost feel like the right side might be more difficult.
I'm going to place my hand on your sacrum again. Okay, we're going to push down here and support the sacrum and the SI joints. Now I'll do it again. Lift your right leg up. Down. Left. Down. How about that time? Better, same, or
That
worse?
felt better on both sides. It felt like just smoother, I guess.
All right, I'm going to push into the L5 here. Do you have any pain, discomfort, tension when I push here?
No, not really.
4 here.
A little more tension.
3 here.
No.
2.
Can't tell if that's just on the left side because like my muscles are like sore or if it's like actually a problem.
So left short, stay short points to the right side SI joint. So we definitely need to adjust the right SI joint as an AS, which leaves adjusting the lumbar on the left at either L4 or L2. So
Yeah, that's,
right here, right?
yeah.
This is that L2. This is right side?
Yeah.
This is the one that didn't let go. Tensegrity tells us what's happening at the bottom of the spine to the top. Left or right, which is more tender here?
Honestly left, I feel like.
Left, right.
Yeah, they're both sore, but I could feel that on the right side sharp.
Okay, so PRI in the lumbar spine. 1, 2, 3, 4. How's that chop fiber feeling? Is it still tender?
It feels really good actually.
Okay, good. All right, so I'm going to bend the top leg like this. The bottom leg stays straight. I'll scoot you forward here just a little bit to the end of the table and pull the shoulder out like that. That's good. All right, so first I'm going to adjust the lumbar spine. So there's 2 adjustments here. I have to adjust L2. We find it by finding the top of the hip. Here's L3. This is L2. Okay, nice, gentle breathing. Okay, so this one's gone to the side like this and it's twisted like that. So we're going to bring it that way. Okay, let's try it out. Go ahead and take a deep breath in. Good, and out. Good, loosey-goose here. Let everything sink in. Let the hips go. Good.
I don't even know what that was.
It was crazy awesome is what it was.
Oh, it's amazing. I feel like if Kit Kat and Twizzler had a baby. Because I'm like all twisty like a Twizzler, but I'm crunchy like a Kit Kat. Which actually might be the next greatest invention.
All right, I'll edit that out. We'll write it down.
Twiz Cat.
You're breathing. I'm going to bend this top leg like this. Bring your hand right there. That's nice. Okay, we're breathing. As you breathe out, we're going to follow your breath. We're going to bring the hip down and then push like that into the SI joint. Another breath will follow this breath out. Okay, lie on your back.
I can't laugh.
Let's check in on this occipital fiber. Still pretty gnarly in there, huh?
It hates me.
Okay, it's okay. It just needs work. We're gonna nice, gentle breathing. We're just gonna traction here. Sink in with your breath. No, your occiput's clear. That's because that's what cleared earlier. No, I misspoke. Okay, so for this one, I'm going to bring your head over to the side like this. I'm going to contact like this right here, and then we're going to push in that direction, okay?
Okay.
Okay, nice and gentle breathing. Go and take a deep breath in. Good. Gentle, gentle. Let the head relax here.
Yeah, that's nice.
Right there. Mm-hmm. Okay, let the head drop in. Good, good. Following the breath on the out breath, like this in this direction. Good. Good. Let the shoulders go, hips go. That was okay, Harper, but there's a little bit more. Hold on. Good, loosey goose.
Yeah. Wow. Oh. Did I get taller?
A little bit, probably.
Yeah.
Ooh. All on this left, these 3 toes right here. I didn't want to. Sorry. All right, so this is full spine adjustment. Harper, as you breathe out, I'm going to go in this direction like that. At the end, we give a pull, okay?
Okay.
All right, let's give it a try. And out. One more time, we're going to follow this breath. Good, and out.
Holy crap. Wow. It just goes all the way.
Mm-hmm.
Kind of just feel like a little jellyfish right now. Keep on floating. Oh man. Oh wow. Yeah. Just gonna. Okay.
So you're going to squeeze my fist in between your knees. Okay, relax. All right, push your knees out to the side against my hands. Push out to the side. Push, 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 push. Relax. Okay, you're going to squeeze again. Squeeze. It's tight in there. Okay, relax. Okay, let's try it again. Push out to the side. Push, push. Push, 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 push. Push, 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 push. Okay, relax. Okay, you're gonna squeeze my hand again. Squeeze. Almost. All right, relax. Okay, hold your knees together now. Hold them together as tight as you can. Hold.
I felt it on the left side.
You did? Felt
Yeah, I
it in
felt
the front?
one right here, on the front.
Traditional Chinese medicine and Ayurvedic medicine both use a 3-point pulse reading, 3 points like this. In Western medicine, they only use a 1-point pulse reading, but they measure 4 things: rate, rhythm, contour, and amplitude. Almost all of that has been lost over the years. Now we only check for rate. But contour and amplitude is what they measured in TCM, Traditional Chinese medicine, also Ayurvedic medicine. So 3 points, and there's 2 layers, a superficial and a deep, both sides. So that's 12 total points with 12 organ systems and meridians that are associated with them. So this represents a scan of the entire body. That's where we're going to focus some of the gut and digestive work today too.
Okay.
All right, so let this relax again. But your pulse is very balanced. Your constitution is balanced. Slightly more dominant in the fire element. So you would be considered a pitta in Ayurvedic medicine. In exercise science today, they would call it a mesomorph. You're inclined to gain muscle and also lose it, depending on however you're using your body. fire signs are usually pretty aggressive too. Emotionally, mentally, spiritually. I find a lot of cops that are pittas. A lot of lawyers are pittas.
I did go to law school for a semester.
The key medicine for a pitta is usually that you need to slow down and cut and cool off. All right, so we're gonna do some reflex points for the gut. Is this tender right here?
Yeah.
Let me see the other one. Is this tender right here?
Yeah.
More on this side?
Maybe, yeah.
All right, hold on. One more reflex point.
Okay.
Test the biceps tendon here. Is that one tender?
Yeah, that one's tender.
All right, we're gonna start here because this is the least tender out of all of them. You can put your legs back in. Okay, the ileocecal valve is the window between the large and the small intestine.
Okay.
So it's where food goes from the small into the large intestine. Sometimes the valve can get stuck open, sometimes the valve can get stuck closed. Either way, it causes issues. You should be able to feel which one it is, if it is. All right, so we're going to locate this valve first, and we're going to find your belly button, okay? The first landmark is your belly button. The second one is the ASIS, the front of your hip bone right here.
Okay.
This is 1/3 of the way from the hip bone up to the belly button. So it should be, we start looking for it here. Yours is here. Nice, gentle breathing. I'm just going to do some circular motions right on top of the ileocecal valve as well as the abdominal reflex at the same time. Good, breathe into your belly. Yours is in good shape right here. There's no food around it right now, so that's optimal. Okay, that's good. Okay, now let's go back to this one. This is the second most tender. Okay, so this one's for the gallbladder. Tender?
Yeah.
All right, so the gallbladder, we find it, this is called the gallbladder duct where it dumps into the duodenum is called the ampulla of Vater. So we're going to find that by first again finding the belly button. That's the landmark. We go 2 inches lateral, 2 inches superior. We start here at the costal arch. See, it was just waiting right there.
That sound.
And it was right underneath my fingertips because that's just a common place for things to get delayed. That was a good release though. Let's see, how's this feeling here? Is that still tender?
It's a little tender, but it's not as sharp.
Good, 3 breaths.
So weird. It's so cool at the same time. Holy crap, moly.
Okay, so this is the reflex point for the stomach. This is 2 inches above the belly button. Now, you have not eaten in many hours.
It's been since last night, yeah.
All right, so this is halfway between the xiphoid process. So your xiphoid process is here. Belly button is here. Is that tender?
Yeah, like towards that left side, yeah.
Okay, and this is this abdominal reflex for the stomach, which is over top of the pyloric sphincter, which is where the stomach empties into the duodenum. It's tough in there.
That's weird.
It's tight. You're going to feel a lot better after this. Like in a lot of different ways.
Yeah.
All right, so this is a Soaz stretch, okay?
Okay.
Okay, I'm gonna place my arm underneath of your arm like this and hold on to your knee.
Okay.
And I'm gonna contact the psoas muscle with the knife edge of my hand over here. Tender?
Yeah.
Ticklish or tender?
Tender.
Okay, try to let your stomach relax as much as you can. You're breathing.
Am I?
Okay, breathe. Good, again. Good, you're doing good. It's letting go. Whew. Breathing.
Oh. Oh. Oh.
Okay, this time I'm gonna use the knife edge of my hand. This is the hip bone right here. We're gonna come straight off the hip bone into the psoas muscle. You're gonna take a deep breath in. Good, and out. Nice job. All right, there's one more psoas. maneuver here, just sliding off the front edge of the hip bone, ASIS. Okay, bring your left knee up. Bend your left knee so your foot's flat. Okay, now I want you to pick your foot up and raise it up towards the ceiling.
Ah.
Higher. Keep going as high as you can. Okay, now lower it down slowly to the table.
Oh, fuck. Fudge.
Breathe. Breathe. Breathe.
Oh.
Breathing.
So as for me, that doesn't feel great, but it does all at the same time.
All right, so this is now this is a uterus prostate reflex adjustment, okay?
Okay.
All right, so this can reposition an anteverted or a malpositioned uterus.
Okay.
So what you're gonna do is place both thumbs on the top of your pubic bone.
Okay, so like right here.
Yep. Okay, I'm gonna contact your thumbs, okay?
Okay.
Okay, I'm not touching your abdomen at all. I'm only touching your thumb.
Oh God.
Right or left or both?
Both. I think maybe the right is where. I mean, honestly, it's both.
Okay. Okay, you're breathing. As you breathe out, I'm gonna follow your breath.
Ooh.
Just take up a little
I
slack.
do have a sharp pain kind of on my left side.
Mm-hmm.
Okay, that's normal.
Get another breath in and out. One more breath in and out. Breathe.
Why does getting healthy hurt?
We broke through some layers that time, but there's a little bit more, so we're gonna do it again. You're doing good. Okay, you're doing good. You're breathing.
Ah. Let there be light.
Try to go like this, put your hands on your hips. You're gonna push your elbow back in this direction against my hand, okay?
Okay.
Okay, pull. Harder. Relax. Pull. Okay, I'm gonna crack your ears.
Oh gosh.
I didn't know ears could crack.
Shh.